Assalamu alaikum. Thanks for the organizing committee to give me this honor to present our work in Bani Suef University. My study is on the microRNA 126 and the vascular complications of chronic renal failure patients on hemodialysis. Our background, atherosclerotic diseases is now a major global public health problem, and increased carotid intimal medial thickness is a hallmark for atherosclerotic diseases. The carotid intimal medial thickness is a measure of the to diagnose the extent of atherosclerosis, and it measures the thickness of the inner two layers, the carotid intima and the carotid media. Cardiovascular disease is a frequent complications in our patients with CKD on hemodialysis. The vascular calcification is also an important problem. Calcification of the arteries occurs in the intima intima in association with atherosclerosis, where it may contribute to the plaque formation in the media, and it causes the vascular stiffness. Increased serum level of calcification promoters such as hyperphosphatemia and decrease in the circulating and local inhibitors of calcification favor the vascular calcification and accelerated the atherosclerosis of the media and lead to increase in the prevalence of coronary artery disease, heart failure, strokes, and peripheral vascular diseases. The prevention of the cardiovascular disease is an important consideration in the management of CKD patients. The pathogenesis of atherosclerosis involves many conditions like inflammation, metabolic disturbances, lipid accumulation, oxidative stress, immune pathology, other risk factors like pollution, smoking, diet and lifestyle, and as well as epigenetic regulators, in particularly the microRNA system. MicroRNAs are a class of around 22 nucleotides, non-coding RNAs, that regulate the gene expression by either translational repression or messenger RNA degradation. The microRNAs have been shown to play a critical role in various cellular processes and inflammation and angiogenesis. The microRNA 126 is one of the most widely expressed endothelial microRNAs, and it has been shown to play a critical role in the regulation of inflammation and angiogenesis. Moreover, microRNA 126 is also involved in endothelial dysfunction through the reduction of VCAM adhesion molecule expression, thereby reducing leukocyte adhesion to the arterial wall. In particular, microRNA 126 has been reported to control the vascular homeostasis, angiogenesis, and vascular repair. The aim of our study to investigate the association of microRNA 126 and the vascular complications in end-stage renal patients on hemodialysis. The study, including 50 end-stage renal disease patients who have been receiving maintenance hemodialysis 3 times weekly for more than 3 months. 20 healthy adults without any evidence of chronic kidney disease or any inflammatory or vasculitis included as a control group. The inclusion criteria for the patients includes end-stage renal disease on regular hemodialysis diagnosed by ultrasound and estimated eGFR less than 10 milliliter per minute. The exclusion criteria, these are for the control group, the patient with normal kidney function, estimated GFR below 90 milliliter per minute, vascular disease, having any history of vascular disease, having any history of familial hypercholesterolemia patients. Patients and methods, all the participants were subjected to the following: full history taking, full clinical examination, routine laboratory investigations, special investigations like the duplex of the carotid arteries and measuring the carotid intimal medial thickness, and the measuring of the microRNA 126 by the PCR technique. 20 of our patients on hemodialysis were starting the dialysis due to a long-standing history of hypertensive nephropathy. 5 patients with end-stage renal disease are due to diabetes mellitus. This is a small number of patients, but this is the fact in our unit. Only 5 patients on hemodialysis has history of diabetic nephropathy, and 10 patients with end-stage renal disease due to glomerulonephritis, 15 patients with end-stage renal disease due to impacted renal stones. Our results shows was comparison between two groups regarding the age. There is non-statistical significance between the study group and the control group regarding the age. There is no statistical significance between the patient groups and the study groups regarding the sex. There is comparison between the two patient group as regarding the carotid intimal medial thickness. Of course, the patient on chronic hemodialysis has more thickened carotid intimal medial thickness than the patient with on the control group. This is comparison on the years of dialysis, the long history of dialysis, and in our patients in the unit. Most of our patients, or the higher concentration, is in 3 years and 4 years on hemodialysis. After 5 years, the percent of hemodialysis patient starts to decrease. The comparison between the two groups as recording microRNA 126 is it's statistically significantly higher in the study group than the control group. This is the correlation between the years of the dialysis and microRNA 126 patients in our study group. It's shown that it increased, positively correlated with the increase in the years on hemodialysis. This is also a correlation between the years of the dialysis and the carotid intimal medial thickness. And this goes with the mind that increasing carotid intimal medial thickness and vascular complication occur after many years on hemodialysis. The correlation between microRNA 126 and the carotid intimal medial thickness in our study group showed that there was positive correlation between microRNA 126 and the carotid intimal medial thickness in our study group. In conclusion, atherosclerotic patients have significantly higher microRNA 126. The carotid intimal medial thickness is positively correlated with microRNA 26 and positively correlated to the number of years on hemodialysis. And important findings in the study is that microRNA 126 would be a good new biomarker for the identification of subclinical atherosclerosis for patients with on hemodialysis. My recommendations is to do more studies with bigger number of patients to investigate also more microRNAs in the involvement of the vascular complications in hemodialysis patient, correlating our results with other biomarkers for atherosclerosis and vascular complication. I was helpful to show you the results of my studies, but there was no enough time to prepare them for this conference. Thank you so much.
Thank you, Doctora, for your very nice